Warm welcome to you, Caroline. Thanks a lot, Kira, and hello to you all. And I would like to also invite my co-chair to the stage, Pauline Hastenteufel. She's also a member of the youth representation group of the Joint Action Prevent NCDs. And you are also a chairperson of the task force on ableism at the International Federation of Medical Student Associations. No? Yes. So it's wonderful to have you on board. We will settle ourselves here at this little table. And it's so nice to listen to all of the conversations until now. And so nice to hear also that everyone comes from different backgrounds and different perspectives. And I wanted to share with you sort of my perspective, because I'm director of EuroHealthNet. And EuroHealthNet brings together almost 90 organizations, of which a majority are public health institutes, and we aim to tackle health inequalities, and we very much embrace the concept of a well-being economy, because it allows us to work on health and policies and to go even beyond that. No, it's really about a systemic change that we want to see. Someone mentioned the concept of sufficiency. Well, that's kind of quite a paradigm change that we want to see, and that's why we're really embracing it. We are based in Brussels, and there starts the complicated matter, because in Brussels at the moment the situation has quite changed. One of our tasks is to monitor European Union policy making and to provide input and to see what we can do to have some impact to make sure that policies steer to health equity. But the new European Commission have designed a new instrument, and that's the competitiveness compass. And that's their Northern Star. So all of the European Union policy making will look at competitiveness, and it is everywhere. So we have our well-being economy compass, and there is the competitiveness compass. So how are we going to deal with that, and what are we going to do? And that is what I want to talk here about also with you. We'll give you a short exercise. But one way of working we are using, and that's why also I like the well-being economy concept, because we use it as a chameleon a bit. No? So depending on the audience we talk, we highlight the element that works best for that audience. There is, for example, one reference to health in the competitiveness compass, only one, and you can maybe guess what that is. That's a reference to active and healthy aging, because of course having a healthy workforce is important for the economy. So we have to work with the policy hooks, as we are saying, to push for the well-being economy, and that is where I'm coming from. But we have Pauline, and Pauline, you are coming from another perspective, looking at the discussions that you've learned until now. And how are you looking at the well-being economy? What's your take on this?
Yeah, first of all, it's been such a filled day that there's been so many thoughts running through my mind, and I guess that's the same for all of you. But what resonated with me a lot was when Emma just said, acknowledge the problem. And I think when we're talking about economy and public health, especially, it's important to acknowledge the problem. And I brought a quote from, I don't know, some of you might know, the Socialist Patient Collective, and it's a quote from the 1970s, so it's been a while. But it says, cure can't be understood in our system to mean the elimination of illness. It says it serves exclusively as the maintenance of the ability to go to work where one stays sick. And that's what you just said. It's health is a means to an end, and that in the past, health systems have only been the means to an end for the economy. And because our capitalistic societies are based on the exploitation of people, but also places and the world, I think it's really important to acknowledge that, and acknowledge that what Emma talked about with colonialism, that colonialism is rooted in the exploitation of people and places, and that the ageism and ableism that Cameron talked about is also rooted in the non-available exploitation of young people because they can't legally work yet. Or ableism, the exploitation not being possible of disabled people because it would require the need to accommodate them. So when we want to improve our illness system, as Ilona said this morning, I think we need to look at the economy and not look at health as a goal of the economy or the well-being economy, but look at the well-being economy as a means to health, and more specifically health for all.
Exactly, that is our vision, and that's what we want to achieve. But not everyone thinks about that in the same way, and not everyone has the opportunity to work on the economy in such a way that you make sure that economic works for health and well-being. So we want to give you an exercise. At the table, you'll have maximum 10 minutes. And the question is as follows. So how will you bring the well-being economy in your work to have impact on health? And what are the barriers and what are the enablers? And we would like to know what you see as a barrier. For example, the fact that we are locked into our systems and it's maybe difficult to do things differently. And what can be an enabler. For example, having alliances, which brings other opportunities. So you have, well, a little bit less than 10 minutes, I think. Let's say 5 minutes to discuss at your table or with your neighbor. And then we would like to hear from some of you what you think is the enabler that works to work on the well-being economy in your work, and what is the barrier that you feel is in your job. Yes, time starts.
Okay, thank you everyone. This has been 5 minutes. Please come to an end of your discussions. Okay, so is there anyone who wants to briefly present? Yes, at the very back. Could we please get a microphone?
Can you hear me? Yes. Lucia, I am part of the Youth Advisory Group as well. The discussion that we had in our table was mainly about things that are more of a barrier towards being able to implement this. We had a discussion about the cultural or societal way of seeing work and how we appreciate socially people who overwork and how complicated it is for us to move away from that overproductive way of living when we are currently making a round of applause to people who are staying late at work, doing emails at 11 o'clock, and we need to move away from that to be able to actually have a cultural shift and be able to implement the well-being economy effectively. The second point that was raised at the table was about the actual definition and understanding of the well-being economy, because currently we believe that this concept is very well known by us, but maybe not by the whole population or by even groups of people who are very much active or could be active within the well-being economy. And actually the work that Sciences Po were doing and presenting outside, I think it's a very important work because that would allow to have very concrete examples and showing them to people so they can actually understand how we implement well-being economy, how they can do it. So it's easy to do and like they're ready to actually take action. And to finish, we also had a last thought about how we are not really currently listening to each other. We are very good at expressing ourselves, at having discussions, but actually listening, actively listening, we're not trained to do that. During our childhood, we're trained to do maths, to learn history, but we never have an actual class in like how to listen to each other, not necessarily to respond, but to actually learn from what is being said. And that leads to sometimes circular conversations that do not lead to an actual action.
Yes, thank you so much, Lucia. Is there anyone else with a short summary of what they've discussed?
Right.
Otherwise, we're going to, yes, we're on time again. I
Yes,
guess.
yes, good. So let's...
Oh, wait, at the very front. Yes,
Yes.
a very brief. Yes.
I'll make it like 20 seconds, I promise.
Perfect.
So I'm kind of like trying to figure out how I can make a local impact on a global level, because I have family, I have a girlfriend back in Ohio that I really care about, I love, but I do see the value of making these large-scale changes. So if I have like a background in like marketing and regenerative agriculture, just dabbling, I'm not sure exactly how I can use those kind of experiences and then actionize it, and then maybe create organization or just some sort of movement to be able to, I don't know, feel like I'm using my experiences in the way that is able to make this kind of circuit of energy happen. So any advice would be awesome.
Oh, yes. Well, I think already the fact that we're all here together and with all of our alliances and connections, it was mentioned earlier also by Emma, for example, that is definitely a way forward to accelerate the impact, and it's a bit of a snowballing effect, no? If we talk about well-being economy to others, and then, we take this further. Yeah.
But I'm not mistaken if there's a session tomorrow from global to local, so the other way around. But maybe you can also ask the session there. They'll probably be really excited to answer that as well.
That'd be awesome. Thank you.
Right. Let's ask the same question to Mika Salminen. And I'm very happy to introduce Mika. He's the Director General of the Finnish Institute for Health and Welfare. I saw in your bio that you are also chair of the Planetary Protection Working Group of the European Space Agency.
That's
Very
true.
interesting. And I also saw that we have something in common, and that's that we both like to cycle to work as much as we
Yes.
can. And,
Yes.
and I think that is well-being economy at a very micro scale, but very important.
Sure.
So Mika, you're in charge of this big institute, over 1,300 people or so working there. And so how are you making sure the institute and all those 1,300 people are working towards a well-being economy? And what do you see as barriers in order to get that, to make that happen, or enablers?
Okay, so well, I would start with actually what our institute is called, because we are not the Public Health Institute. We are not. We are the Institute for Health and Welfare, and that's a bit different from the traditional sort of maybe thinking of the public health world. It doesn't mean that we don't have all those functions. We do, but in our thinking, I think we have already some time sort of incorporated the view that there is no health, there is no economy without health and well-being, and vice versa. It's both ways around. So the traditional view, of course, is that you have economic growth and you have prosperity, and therefore you can get automatically somehow health and well-being, and we have seen that doesn't necessarily go that way. You actually have to do the investment also to provide for the people in such a way that all the wealth doesn't go to, let's say, the 1% of the population, but you actually work for the people. And I think it's not a sort of a random event that we see that the Nordic societies are on the top of the happiness index. Finland has done this 8 years in a row, which always astounds us, and maybe we start to believe that it's actually true after 8 years. We are a little bit slow to learn. But the background there is that we have actually been able to build a system which is fairly equal. It's not perfect by any means. We have very rich people, we have some people who are poor, but maybe the differences are not that enormous. And if we think about enablers, I think that's a very good question. We are a small country. We have a fairly long tradition of working together. It's not always easy, it's not always perfect, but I can call my colleagues in the neighboring ministry if I really need to, without having to always ask for permission from my own state secretary, which I think is a good thing. That doesn't work everywhere, and I think that's one of our strengths. Of course, I will inform them if we start doing something very big, but still, that's the thing. I think that's one of the enablers that comes back to trust. And that's not only in the sort of civil sector, it's also in society as a whole. When we look at what happened during the pandemic, where the Nordics did quite well, with any indicator that you would like to look at, what comes up as an explanator is the trust. That actually people mostly believe that the system is there for their benefit and not just for some corporations or some rich people. Challenges, of course, is that, and I'll show you a short videos soon, is that we have to start thinking about this in a much more global scale. And also, people with a health education background are not always so interested in the economic part. And we need to understand that too. And that's something we are working on. We have a lot of expertise in it already, but not enough from my point of view. Mm-hmm. But maybe I'll show you the video and we can take it from there.
Human. You are a thinking, multidimensional being, part of a wonderful, intricate system, part of the planet we call Earth. Together, we have succeeded in building an equal and safe welfare society, one of the best in the world. Today, the world is better than in the past, but also more unstable. We are tested by pandemics, humanitarian crises, and growing social inequality. Our greatest challenge is the global environmental crisis. It's time to shift our focus to planetary health and well-being. We must understand that we are part of the Earth's entire ecosystem. Our mission is to secure the sustainable well-being of both people and the environment. We turn science into action. We produce up-to-date research data that helps to make wise decisions and find new solutions and opportunities. Together, we will create change. We improve the health, well-being, and functional capacity of the population. We reduce inequality. We enable a sustainable lifestyle and inclusion for everyone. We work for you. Whether you are strong, weak, healthy, ill, big, or small, you are the entire planet.
Yeah, thank you so much, Mika, for bringing this amazing video. I think you are the planet.
Sure.
It's a very beautiful message to resonate with us. We've talked earlier today about also the fact that the world is changing, and unfortunately, the topics we're discussing are not welcome in all parts of the world. Finland has been doing great in the last years and has been the happiest country for 8 years in a row. What can you give as advice to all people from countries who might not be there yet or who might be going in the other direction? Maybe a lesson learned of how you can convince people that they are indeed the planet.
That's a very big question. But I think. I mean, I'm an optimist. Politics and the world situation go in waves, and there will be a time when we may be going in the other direction again after we have learned again the hard lessons. We just hope that they will not be too hard. That's something we don't know. It's very difficult, to sort of give any countries sort of comprehensive advice, because everybody has to start from their own environments. I was thinking here earlier when we had the eloquent speakers talking about the decolonizing of health, and mentioned that most of the sort of Western societies are colonial histories. We in Finland usually think of ourselves not to having that. That's actually not quite true, because we have an indigenous population in the north, the Sami people, which we share with Sweden, Norway, and also Russia. And actually, there is not a great history there. So I think we have to revise our situation there. So maybe my advice is to take the advice from the speakers in the previous session and really look hard at this and not work for, but let those populations work for themselves and truly engage them and give them the power of their own future. I think that's something maybe that we all could learn from that.
Wonderful.
Thank you so
Thank
much.
you.